Welcome back to the School of Hip Hop. I'm your local lady Woo, host and creator, all that little bit. School board is in the building. Introduce yourselves.
I'm Tremelia, aka Too Pretty.
This is April C.
Tiffany.
It's Courtney, aka Mr. 35064.
Mr. Corey. Okay, Marco B in the building.
And of course, Mr. Bay in the building.
All right, special guest, our friend Dr. Farina Willis. How are you?
Good, how are you?
Great. Welcome to the show. We talk about men's health. Several episodes and segments on men's health, and I know the men are energetic and going because they've learned a lot of things about themselves that they didn't know. They didn't know what the prostate was for. They didn't know where it was, and they didn't want to have the screening. So the men got a lot accomplished. Ladies, I think that women are pretty much more in tune with what they have going on, what they have, what it's for, right? Typically. Dr. Willis, how often do you see women that don't know what's going on or what it's for?
Very rare.
Okay. Okay, good. Ovarian cancer. September, ovarian cancer awareness. That's not as popular as other cancers, or is it?
It is as popular, and actually ovarian cancer has a higher death rate than most cancers that affect women. And the reason why is because we don't have a good detection system set up to detect it early. So by the time a woman comes in with ovarian cancer, she's in her end stages and she's dying.
Okay, let's go back. I know we know what the ovaries are, but just refresh us on what the ovaries are and what they're for, where they are.
The ovaries are in the pelvis. They hang on the side of the uterus. They're there because that's where your babies come from. So they house your eggs. Okay. A woman is born with a certain amount of eggs at birth. And throughout her lifetime, she ovulates and she releases these eggs, and that's how we get our cycles. And either you become pregnant or you don't.
Okay.
It's thought that ovarian cancer is linked to the amount of times that a woman ovulates. So women who don't have kids and who have not been on birth control are at a greater risk for developing ovarian cancer than, say, a fertile mom that has had 5 or 6 kids and have been on birth control in her lifetime.
Do any of y'all have children?
I don't know.
Oh, yeah, would have had some babies. Marco, you don't have ovaries. So they are very important. They are very important. Ovarian cancer, the cancer of the ovaries. We learned from Dr. Bivens that cancer is what?
The cells that don't work together.
Yeah.
Bad cells.
Basically, that attack.
The immune system under the cops.
Right.
So with the ovaries, what happens with cancer of the ovaries?
Similar to probably what Dr. Bivens said, cancer in general is when your body can't defend itself against cells that are not supposed to be there. And so you don't have a defense mechanism, and the cells that are mutated or abnormal continue to grow at an abnormal growth rate. And so you have nothing to control it, and it becomes a cancer.
Your fears of ovarian cancer, ladies? Not really concerned about it? Hadn't thought about it?
Hadn't really thought about it. I guess because you feel like, okay, well, I go and get my annual, then I should be okay. And if something's wrong, then somebody, my doctor will tell me.
What are the symptoms of ovarian cancer?
And that's the thing. It's so generalized. By the time a woman comes in, she's been to see a GI doctor, she's been to see an internal medicine doctor because she's complaining of bowel problems, constipation, early satiety, meaning she starts to eat, she take a couple of bites, she get full quickly, but yet and still her abdomen starts to expand. So she's bloating, can't get her clothes on, and most people think you're pregnant, but you're not. And all that is ovarian cancer.
So the stomach just swell up like you're pregnant?
Stomach swells up like you're pregnant. You get abdominal pain, nausea, vomiting. So you think you might have a GI bug of pregnancy symptoms, and it's not pregnancy.
How does that make y'all feel?
Nervous.
Yeah, because for as much as you have a cycle every month,
right,
and you bloat, it may not be that.
So let me ask you this question. Okay, if those are, some of the symptoms, and let's say if a woman thought she was pregnant, would have took a test and it wasn't, you know, she's not. If she decides to go to the doctor and they see it, is it something they can do then? Like they detect it's ovarian cancer?
If it's caught early, for most women, depending on the type of cancer it is surgically taken care of. And in essence, most women end up with a hysterectomy. So it doesn't matter about your age. It matters about what type of ovarian cancer it is and how aggressive it is.
What about race? Does it play a part in it?
No.
I thought that was like a white woman disease.
No, matter of fact, in my residency, I saw a majority of African Americans with ovarian cancer. So I wouldn't say it's a white woman. It may be because they have better health care access than most African Americans. You know, by the time, remember what I said, by the time you come in for it, it's spread everywhere. So unless you're really aggressive to find out at autopsy, where did it originate? You know, that's where the family history come in, and women will come in and they'll say, oh, my grandmother died of some type of cancer in here. And I'm like, what's in here? Well, in her pelvic area. Well, was it ovarian cancer? Was it uterine cancer? Was it cervical cancer? I don't know. But by the time we knew about it, it was everywhere. So, I mean, I think because we don't have good access to health care, most African American women don't know.
Courtney, you got a question?
I was going to ask her, what's the link between, if there's any, between ovarian cancer and endometriosis? Because I've noticed that a lot of black women actually do have fertility issues.
True, very good question, sir.
To my knowledge, there really isn't a link with endometriosis and ovarian cancer. Endometriosis is another whole issue. That's where the glands that are normally found inside the uterus gets on the outside of the uterus, and it can attach to the bowels, it can attach to the abdomen, it can attach to the lungs, it can attach to the heart. Anywhere there's blood flow, then these endometrial glands can go. And because they're not supposed to be there, if your immune system is not up to par to get rid of them, then they attach and they grow. So what happens with endometriosis, every time a woman has her cycle, she not only bleeds outwardly with her cycle, she bleeds internally from those glands that are implanted in the wrong place. So I don't really think that there's been a study to say that endometriosis is a part of ovarian
But the guys are very interested in women's health. Corey first, then Marco.
Okay, hypothetically, if, you know, I guess it really doesn't matter, man or woman, if something was wrong, felt something not right in my body, I don't have insurance. I go to the doctor. How thorough would the doctor be before they actually go back to the back and be like, hey, you ain't got no insurance, I don't know how we're going to pay for this test? You see what I'm saying? It's like, because sometimes I've gone to the doctor and I feel like they've treated me or got me well,
Patched you up.
and then patched me up and then kicked me out of the door because that hospital didn't take my insurance. So, you know, or if I go, and I've heard so many people that gone and they, you know, they've said something to the doctor just gave them some pain pills, told them you'll be all right, go to the house. And then in a month they'll go back and they found a growth that apparently they weren't thorough enough the first time to go and look. So when does it begin to be a finance issue as far as me trying to be preventive, you know, take preventive measures to take care of myself? Because if I don't have insurance, first I'm not going to run to the doctor.
Okay, good question.
Well, that's a very broad question to me. And I think that's doctor dependent, that's hospital dependent, because every person's going to be different. Now I can answer from my perspective. If you come into my office and I say, well, I think this is what's going on, and you talk to me and say, well, Dr. Willis, I don't have insurance to do the test that you're asking me to do, then I might say, well, let me talk to the hospital and say, well, I have this patient who is indigent, and I'm treating it as an indigent person. I'm not getting paid what I would normally get paid. Would you be willing to take whatever they can pay you to get this test done? And then if that was not an option, then there's always the state hospital. And a lot of people don't want to go to Mercy. But I mean, those doctors are still medical doctors.
Right.
And I heard you sniggling saying that's where they kill people, but if you think about it, every hospital, every day, has somebody that dies.
Right, if you walk in already with ovarian cancer and you're about to die, you're going to die wherever you go.
I want to speak on that too. I mean, I was on the board of directors for a free health clinic.
Mhm.
And what we did in order to make sure that patients who didn't, I mean, that was our whole purpose. We were like, we do not, if you got insurance, you need to go to your provider.
Right.
But one of the things that we put in place was we actually went to the lab facilities, the hospitals, and we asked them to donate a certain amount of tests or money towards tests each year. That way, if we discover something, we can say, okay, look, we can send you right away. A lot of the physicians that volunteered their time actually would tell patients, you know what, I need to see you tomorrow in my office.
Gotcha.
Okay, you going home tonight, but I really need to see you in the morning so I can finish this up. So there are systems out there, and you know, and as a patient, you have to, you know, really work with them too. I mean, just, I know that there's help out there, but I don't really think that,
Right.
you know, in general, I think that's more of a like urban legend.
Typically for things as serious as what we've discussed, prostate cancer, ovarian cancer, cervical cancer, breast cancer, you know, whatever we've discussed, those things, preventative measures, they kind of tell you what to eat a little bit, how to do the self-exam. So by the time you do decide, it's out of order. So at this point, yeah, you are paying for surgeries or for testing. When we talk about symptoms for ovarian cancer, you say there aren't any.
Well, I said they're vague.
Well, yeah, they are. And then they're typical to other things. So you override those symptoms, and then next thing you know, it's brain gets spread. It's everywhere. So I think the thing, more so than just waiting and how you're being treated, is the fear of knowing you wait. If you don't wait and you go ahead and handle these things as they start occurring, well, I'm having this continuous sharp pain. Have you all ever had just sharp pain like
Oh
this?
my God.
Oh,
Yo.
I've been going, like, it's some fluttering, something been going on. I've been to the doctor. I went to my doctor, American Family Care, everywhere, and they did that EKG therapy. But all of that, they gave me some medicine to cause every other problem. I didn't take it, but as soon as I feel something not right, I go to the doctor, and I recommend it to anybody.
Dr. Willis, what is this? You have sharp pain here or here, and it just sporadic. It just happens sometimes.
It just seems like sharp.
Not hands, like
No.
And you said here and here.
like here,
Right here.
So in your
place.
chest,
Kinda
not
like-
your breast.
kind of like side of chest, like kind of here under.
And that's
What are
still,
those?
I mean, on that side, you have to look at, you can have referred pain too.
Mhm.
So it could still be reflux, because you have your esophagus going down the middle. You have your stomach sitting over here to your left. So it very well could be an ulcer, or it could be reflux. So it doesn't necessarily have to be something just terrible that's going on.
Okay, we're gonna take a quick break. We'll be right back. More women's health right after this.